Good afternoon. I'm Center Head Omihwa of Hk이노엔 Biocenter. So I would like to share research R&D and our CMP Development Center. So it's a great honor to introduce our company and research center. So I wish our gene therapy information would be spread to you, and so you could in the future collaborate with our company. Here comes the table of contents. First of all, I'll briefly introduce you about our country and our pipeline and the CDMO project that we began this year. Hk이노엔, through the 38 years, we have been keep working on innovation. In 1984, with the establishment of our research complex, and in 2014, we acquired the shares of C&G개발센터장 as CJ Healthcare, and in 2018 we got incorporated into Colmar Group Korea, and in 2019 we came up with Kcap, and in 2020 we changed our company name to Hk이노엔, and we went public on the co-stock market in 2021. Hk이노엔 has been sustaining a stable growth to expand our market. The annual growth rate of the recent 3 years has been 19%, and our prescribed medicine takes 91%. And when it comes to health and beauty, the proportion isn't big enough, but the hangover remedy and health drink and health functional food, based on the successful launch of the products, we are keep expanding the scope. And based on our Kcap development, within the shortest period of time, we exceeded 100 billion Korean won. In order to continue our sustainable development, we are responding to rapidly changing pharmaceutical environment. The world-class biopharmaceutical platform, we have secured our platform, and we have a stable product portfolio focusing on high-growth chronic disease groups and self-developed products. And thanks to our excellent sales force, we have over 10 products with the scale of 10 billion Korean won. And Inowen's products is gaining wide global attention. Based on our new drug platform, Kcap, we're exporting high quality finished drugs and raw materials to the global market, and we're expanding exports of health functional foods and beverages mainly to Asian countries. In 2018, by 2028, we aim to expand to over 100 countries. So we'll keep putting efforts to achieve our goal. Next is our research and development pipeline. Inowen uses 10% of its sales into R&D. Our continuous investment in R&D, and based on our highly sufficient R&D personnel, we work on cell treatment platforms, among others. Today, I would like to talk about our cell gene treatment platform. The cell gene therapy, based on our independent pipeline development, we aim to expand to the global market. The C&G개발센터장 Center successfully established a facility and one of the biggest automatic production line in Korea. And also, this center, based on co-research, we work on blood cell and solid cancer treatment platform. We are currently focusing on solid cancer treatment, and in order to increase efficacy, we're working on CAR T cell treatment platform. Currently, the CAR T, the main idea is blood cancer, but when it comes to solid cancer, uh, the research stage is at finding the optimal route. So when it comes to solid cancer treatment efficacy, it is an unsolved problem to people. So in order to improve the treatment efficacy, in order to come up with this, we have to consider microenvironment of this, and we have to thoroughly understand the environment, and by overcoming the challenges, we can improve CAR T cell treatment. So TME, tumor microenvironment, is the key factor, I would say. When it comes to blood cancer, when cancer cells and CAR T, they can meet each other without barriers, and we can get rid of cytokine side effects. But when it comes to solid cancer, as you can see on the image, it has a very complex structure. So because of this environment, RT reaching a tumor is a very difficult one. So even if it reaches the tumor successfully, there are various challenging factors that would inactivate the material. So because of those issues so far, when it comes to solid cancer treatment, there is no actual company who have successfully came up with this globally. So in order to overcome this tumor microenvironment, we are working on CAR T CAF platform, and by targeting various materials, we are working on discovering the ways. Next is to maximize a solid cancer treatment platform. So I would like to elaborate about the concept of developing this. We focus on immunogenicity so that a specific receptor reacts to this and react to a specific molecule X. So we focused on those inactivated characteristics so that we can effectively get rid of tumors based on our XCAR-T platform. This platform is more than just merely activated tumor deletion, but also we activate those inactivated tumors. So we get rid of those inactivated tumors as well with this platform. So if you look at the strategy part on the right, the CAR T and XCAR T, if they get combined, even if they recognize the antigen, they lose the offensive characteristics. Our strategy is the molecules that get activated by molecules. We want to develop a CAR T that can recognize this and prevent the inactivation of this and target the tumor and also activate those immune system inside of the cells. Our research team currently working on 3 candidate CAR T items, and we are conducting various bodies of research to see the efficacy. This is an Hk이노엔 CAR T platform. All the 3 types are showing very stable CAR activation rate, and it proliferates in a stable rate. And also the XCAR T from the cancer that activates CAR T, we found a very effective anti-cancer effects. So we're working on developing this to CAR N platform, and the platform has completed getting a patent. And in order to enhance efficacy, We're also working on another platform, and we're also working on getting a patent on that platform as well. So not only R&D, but also we are working on commercializing the GMP. So based on our GMP infrastructure, we are also working on CME. The GMP Cell Center is in Hanam, so it's an apartment type facility, and it has the largest scale in Korea of its kind. And we have production facilities for cell gene therapy in accordance with GME regulations and quality control. And also, we have an infrastructure that is optimal to the production line. The conventional CAR T production facility is this one. Each stage requires a manual, like human manpower, and there needs a highly precise attention. So we wanted to get rid of this complexity. So at our center, we implemented a production auto manufacturing so that you can rely from A to Z. So thanks to this system, when compared to the conventional one, you can get rid of contamination, and you can cut down the expenses and time and the cost of raw material as well. We have 4 aseptic manufacturing rooms which are kept operated, and also we have a quality test and analysis lab, and also based on our process development room infrastructure, we secured the optimal manufacturing line, and we have a very strict quality control from input to output and quality control. We have an excellent product line, so we're taking a leading role in this part. And our project, based on the cell culture technology capability and strict quality control and GMP manufacturing system, we provide customized services according to the development stage of the advanced biopharmaceuticals. And last but not least, the Hk이노엔's CT technology project is based on the next generation technology platform that we have. And we lead the growth of domestic biotechnology and grow into a global CGT powerhouse. So based on our quality control capacity, we will keep leading the global and domestic biotech field, and we will never stop putting our efforts in this regard. Thank you for listening.